Joint replacement surgery. Joint replacement is a procedure whereby one or both the components forming a joint are replaced with artificial components. These are called prostheses. These prostheses are made up of special metal alloy or a special high density polyethylene. Some of the commonly performed joint replacement procedures are: the first one is hemiarthroplasty, also called as partial joint replacement. It means replacing only one side of a joint. For example, the head of the femur is replaced with an artificial component while the acetabulum is left as it is. Indications of hemiarthroplasty: in fracture of the neck of the femur in the elderly. A variety of prostheses are used. It could be a single piece, that is monopolar, or two piece, that is bipolar prosthesis. This is a monopolar prosthesis, a bipolar prosthesis, and a modular prosthesis. In bipolar prosthesis, the motion occurs between two parts of the prosthesis itself. The prosthesis could be modular, where the prosthesis could be assembled on the table from a choice of combination of stem and head sizes. Or the prosthesis could be cemented, where it is bonded to the host bone by bone cement, or it can be uncemented, wherein a press fit design where natural bonding occurs between the host bone and the prosthesis. The operative technique includes exposing the hip, dislocating the hip, resecting the ends, preparing the medullary canal for receiving the prosthesis, implanting the prosthesis in the canal, and reducing the hip and closing the wound. The second one is total joint replacement. This means both the components of the joint are replaced. For example, the head as well as the acetabulum in THR, that is total hip replacement operation. This procedure is required in patients suffering from arthritic afflictions of the joint. The procedure was first developed by Sir John Chanley in 1906. It was successful in operating, giving 15 to 20 years of good function. These are expensive operations because good quality artificial joints are imported. Total joint replacement operations started with hip replacement, quickly went to knee, shoulder, elbow, etc. Almost all the joints of the body have been replaced with varying degrees of success. The two most popular operations are total hip replacement (THR) and total knee replacement (TKR). Total hip replacement. In this operation, both the acetabulum and head of the femur are replaced with artificial components. For the acetabulum, a high-density polyethylene cup is used. For the head, metal alloy, which is a cobalt chromium alloy, is used. Both the components are fixed in place with or without bone cement. Indications of total hip replacement: in case of osteoarthritis of the hip and rheumatoid arthritis of the hip. In general, cemented arthroplasty is used in elderly people with expected lifespan of 10 to 15 years, and uncemented is used in younger people. This is a diagram of unilateral total hip replacement. Complications of total hip replacement. The first one is deep vein thrombosis or DVT. This might occur due to inadvertent manipulation of the thigh during surgery, venous stasis in the limb due to immobility, by pharmacological agents, for example heparin. Others include continuous leg exercises, compression garments, leg elevation. Other complications include nerve pulses, sciatic nerve is commonly affected, vascular injury, fracture. This may occur during the process of implantation of the prosthesis or due to stress concentration. Dislocation may occur due to malpositioning of the limb during early postoperative period. Infections should be prevented. And heterotrophic bone formation, which is new bone formation around the components which decreases the range of joint movements. Under total joint replacements, the second one is total knee replacement. This is also called as the knee resurfacing operation. Only the damaged articular surface is sliced off to prepare the bone ends to take the artificial components which cap the ends of the bones. Indications in case of knee arthritis. Contraindications include sepsis, insufficient extensor mechanism, and neuropathic joints. Relative contraindications: young patients who are below 50 years of age and obesity. Complications of total knee replacement: infections, deep vein thrombosis, nerve palsy, which is common peroneal nerve palsy, fractures, extensor mechanism complications, for example, avulsion of patella tendon, inadvertent cutting of the tendon, knee stiffness due to heterotrophic bone formation or intra-articular operations. Implant and the procedure in total knee replacement. Femoral component is U-shaped to cap the lower end of the femur. Patella button made of polyethylene to replace the damaged surface of the patella. Plastic spacer inserted between two metallic components. And tibial base plate covers the cut flat surface of the upper end of the tibia. Either both the cruciates or only the anterior cruciate is excised. Then we have partial knee replacement, also called as unicondylar replacement. This is a newer operation done for a knee when only a part is damaged. The knee is opened using a small incision. A cap is put on top of the damaged part without removing any ligaments, muscles, etc. It is indicated in strictly partially damaged knee. Then we have total shoulder replacement. The operation has limited indications because osteoarthritis of the shoulder is uncommon. Like in the hip, here also the cup, that is the glenoid, and the ball, which is the head of the humerus, are replaced. Most patients with stiff, painful shoulder due to other causes manage to live with it. The last one is total elbow replacement. It is indicated in stiff and painful elbows due to rheumatoid arthritis and as a fall out of elbow injuries. This technique ensures good function for at least 10 to 15 years.